We've gotten really great insight, really across most of our experiments. We're seeing some type of data that allows us to analyze age and gender. And the state of the state is that older members are typically more engaged in the calls to action we've been driving than younger members are. And women are typically more engaged than men are. And so that to me just looks at we've got this imperative to look at our younger members and men and understand, especially in the case that they're only one in the household or they might be the subscriber, but they need to be communicated with differently. And another layer on this, and this comes again from the work that we've done with Engages, but those younger members, we also know that they have a disproportionate need that they have less experience with, and by extension, they need more help with navigating the healthcare system. So we've got some data around that for those in the 60 plus category, are just more confident managing their care than those under 30. That should be reflected in the way that we're communicating important benefits or available benefits to those two cohorts. One last piece with this, we did have one particular plan where we saw that the more frequently, i.e. if we added more touch points or follow-on communications, we were able to have a greater penetration into men's activity participating in those calls to action. So those multiple touch points can work too. Okay, so insights are only interesting if they start to drive ideas and if they start to drive how you manage in the future differently than you managed in the past. So this is where the brainstorm goes based on some of those analytics that we just talked through, but let's go draft something that is more direct, less emotion-based, and shorter communication, and then carve that off and see how it works versus a control with males. If there's a there, we know that we've now got a new incumbent letter that we're going to send out during that open enrollment period because we're getting X% higher lift. Try those second and third messages for really important calls to action. And here's again where I would invite in, this doesn't have to be singular to print. Part of your multimodal strategy can look at those second and third actions or messages for actions too. And then generally speaking, while what jumped off the page was sort of males and then that delta in the age groups, there's no reason that we shouldn't still be hunting for the other variants that can help us across different demographics. So really different language around the exact same action or the exact same program that we're trying to get a member to be involved in. But if we are leveraging data to understand that for pregnant women, our message looks more like protect yourself and your child. For seniors, maintain your quality of life over the winter season. For healthcare workers, if we know we've got a jumbo out there and we really want to be having a high resonance with that jumbo, then we're looking at, protect yourself and your patients might be a resonant message. Again, none of those are going to be a silver bullet. They're worth testing to understand what's working and how we can start to have a more sophisticated pen in hand when we write going forward. Just a quick hit on this one. We've had so many discussions, especially since COVID, around the utility and the efficacy of QR codes. It's another really interesting place to look at by probably by age, probably by gender, but I think more so by age. The net on this is that across every age category, at least for this plan, and that may be different in your plan, but for this plan, there was always value, at least sliced by age, to adding a QR code to a sticker, to a letter, to a member guide. In some places, that was more pronounced. I think really interestingly, the biggest jump from non-QR to QR happened in the boomer 65 plus age cohort. Whereas millennials, it did have an improved efficacy, more likely to cause action to be taken, but not to the same dramatic degree. So this is one that we looked at with this health plan and effectively said, we probably had a going in assumption about this. And some of those assumptions hold true, but we also learned some things that might help us make different managerial decisions in the future too. I think the main one that would come to mind for me is, do we want to exclude something that is more tech enabled for a certain population? And the learning here would be not the way that we're measuring it today. Regardless if you're Gen Z up to if you're 65 plus, it is additive to use this QR code to drive action.